Hello guys, welcome back to my channel. I am Dr. Himanshu Gupta, and guys, I have been guiding students for the past 5 years in getting good rank in AIMS PG and NEET PG. And so today guys, in this video I'm going to have a very informal talk, like how do we have to choose our branch wisely, right? What are the problems that we face, and how can we remove those problems. So guys, let us see what are the questions that we are having problems with. Many students who have a rank between 1000 to 2000, they are confused whether they have to go for, whether they should go for a good DNB course or an MD from an average college, right? Some people are confused between medicine and radiology, gynae and radiology, derma and radiology. Many students are confused, and students are confused between one college and the other college. Suppose there is one student who is getting radiology, okay, from an average college, and medicine or obs gynae from a good college. So here the student is confused whether he should go for gynae from a good college or radiology from an average college. Then there are various states in which there are 1 year or 2 year bond. So students are confused that sir इस state में तो bond है and should I go for it or not, right? And sometimes I see many of my batchmates and seniors, they come to Delhi from Maharashtra just because Delhi has a better stipend, right? So this is also one of the questions that comes to the mind of many students. So we are going to discuss these questions also, and I want to tell you that NEET PG was very simple, right? So we had a set of syllabus in front of us. We knew what we had to study, what videos did we have to watch, what questions did we have to solve, and similar things were coming in the main exam. Now guys, what is happening here? Now you have got a rank, okay? So instead of 4 options, you have a lot many options that are available with you. And you have options of medicine, you have options of radiology, you have options of gynae, okay, you have options from various colleges, right? And no college is perfect, right? No college is perfect. Sometimes in one college you are getting one advantage, in the other college you are getting some other advantage. So you have too many options, and no option is the correct option, right? No option is the correct option. So definitely guys, this is a very difficult question, that what branch should we go for, what college should we go for. So don't worry if you are having trouble deciding this. Everyone has this trouble. Just listen to your heart, okay? Just listen to this video also. Just have a viewpoint, okay? So this video is only to give you a viewpoint about what branch you can choose, okay? You never have to follow anyone while you are choosing a branch. You never have to listen to just one person. You just have to hear the opinions of many people, right? And hear the opinions of different people about different branches, different colleges, and from many people, right? And after hearing those decisions, okay, just listen to your heart, okay? Before choosing any branch, there are many things which comes to our mind. So there are people who from the first day itself want to go for cardiology, or want to go for any surgical branch, right? There are some kind of people, right? And guys, there are people, okay, who have never thought of radiology, right? There are people who have never thought of radiology as a branch, but when they get a good rank, people say to them that you have a good package, good package, you can earn 3 lakhs per month, 4 lakhs per month. Okay, then their mind starts changing. Then during your NEET PG preparation, you guys were working for or studying for more than 6 hours every day. Okay, you didn't have a work life balance at that time. You had sacrificed your friends, you had sacrificed your family, you had sacrificed your entertainment. But when we start choosing our branch, okay, we start thinking about the work life balance also. Now the difficult question is, सर पैसा रेडियोलॉजी में है, वर्क लाइफ बैलेंस रेडियोलॉजी में है या नॉन क्लिनिकल ब्रांचेस में है, पैशन हमारा कार्डियोलॉजी में है, वी वांट टू डू अ सर्जिकल ब्रांच, वी वांट टू बिकम सर्जन, न्यूरो सर्जन, राइट? सो mind is very confused, right? Mind is very confused. What do we have to actually do? Sir, should we go for passion or should we go for a branch that gives us more money or a branch that gives us more work life balance, right? So very difficult question, right? So guys, now every person is different. So some people they want to earn more money. Some people do not care about money. They just care, they are just interested in being successful in the work that they are doing. They want to do their work properly, they want to enjoy their work, and they get entertainment and enjoyment from their work, right? So there are different kinds of people. Some people want to have some time for themselves, and they really want work life balance, right? So you have to see, the first important thing is that you have to see your priorities. Okay, what kind of a person you are, right? So what I feel is that you cannot get everything. You cannot get everything in one thing, in one branch, right? So you cannot be like, if I just give you an example, that you are preparing for NEET PG. So everyone wants to get a rank 1, right? Everyone wants to get a rank 1, right? Or a top 100 rank, let's say. So if you have to get a top 100 rank, guys, then you have to make a lot of sacrifices. You cannot say at that time, sir, I cannot study more than 6 hours, right? I cannot solve a lot of MCQs. Sir, I cannot watch videos. I want to go for movie also every second or third day. I want to watch Netflix also. I want to watch cricket matches also. So you cannot get everything. Okay, if you have to if you have so many bigger aims in life that you have to get a top 100 rank, you cannot expect to have a family time. You cannot have expect to watch movie every other day, right? So basically the thing is, you have to know what do you want from inside, right? That should be clear to you. If you want to be successful, right? If you want to be successful, if you want to reach great heights, right, then you will have to give up on this family time. Okay, you will have some family time, but it's just a comparative thing, right? You cannot expect to have 6 hours or 4 hours of family time every day, and you can expect to be successful, right? I don't say that having a family time is bad. I don't mean that thing. What I'm trying to say to you guys is that you need to have a priority. Okay, if family time is important for you, okay, then you may have to give up on other things also. What I'm trying to say, that you cannot get everything at the same time, right? So you have to see that are you so passionate about doing surgeries that even if you work for free, okay, or even if you get less salary, okay, even if you have to prepare for 1 year after doing MS, okay, you are okay with that because you are more interested in doing surgery, you are more interested in treating the patients, right? Then it does not matter whether the other person, other person in radiology or any other like lighter branch is, doing SRship earning more money than you. Are you getting my point? Right? So you should be that much passionate about your branch. Okay. You should have a priority to your success. And at that time you should not feel कि यार मैं तैयारी क्यों कर रहा हूँ. Okay. At that time you should feel कि यार मेरा तो एक बड़ा एम था, मैं सर्जरी करना चाहता था. आई वांटेड टू डू सर्जरी, आई वांटेड टू डू coronary stenting. If you want to go for cardiology, I wanted to learn endoscopy, I wanted to do colonoscopy, right? So that was my priority and it didn't matter even if I had to work hard during my PG, right? So this is the main point कि आपकी प्रायोरिटीज होनी चाहिए. Okay, if you are going for a harder branch, okay, you should be passionate about that thing, right? And if you have a priority, okay, if you are someone who want to visit your family every second week or every third week, you want to be available for your family, right? Then that is your priority in life. It does not matter to you like if the other person is doing well in life, okay, he becomes a great doctor, he becomes a great teacher, okay, it does not matter. You want to be available for your family, then you have to have this as a priority, and you should not regret anything that I'm not good in this thing, right? If you have a priority of watching movie every week, okay, then you should not regret that the other person is doing well, right, in your own field, in the other field, right? You should not regret about it, right? So the most important thing is that you should have a priority. What do you actually want in life? And for that priority you will have to give up a lot of things. Let me just give you an example, right? So if a person has priority as money, okay, and work life balance, okay, and he goes for radiology, right? So I feel that that is also a sacrifice. A radiologist makes a sacrifice. It's a very big decision. Taking up radiology as a branch is a very big decision because you are giving up on the patient interaction. So if someone chooses for a radiology, that student is also making a sacrifice or of not having patient interaction in his life, because throughout the MBBS, okay, the perception of a doctor is seeing the patients, and when a person is keeping his priority as money, as work life balance, then he is also sacrificing something, and that is the sacrifice of not having to see the patients, right? So you have to be clear with the priorities. Now guys, many people are confused about money, okay? So let me tell you something, okay? There have been periods during my life where I have earned a lot of money also per month, and where I have earned like everyone else, right? So, and I want to tell you something about the experience that I have with money, right? So how does money change your life, right? So like most of the people, recently I had one student, okay, so basically he was saying that he is confused between peds and radiology, okay. So I told her that the difference between peds is and radiology is that with peds you will get 1.5 lakh salary after 6 years right, of a normal MD and SRship, and with radio you may get 2.5 lakh, to 3 lakh. So that is not a very big difference. So what I want to tell you about money, that money is needed to satisfy your basic needs. Okay, food, okay, home and clothes, right? And I can tell you that all these basic needs, now you have become doctors, all these basic needs will be satisfied with every branch. Okay, with every branch, any branch that you take, these basic needs will definitely be satisfied, right? And for a person living in Delhi, these needs can be met between like 30 to 50,000. Even 50,000 is a bigger amount. And I can tell you, every doctor is going to have a salary of more than 1 lakh rupees, right? So these basic needs are going to be met by every branch. Now the thing is that any amount of money that you earn above 1 lakh rupees or 2 lakh rupees, that is just for the purpose of luxury, right? That is just for the purpose of luxury. Even if we think about future, right? We think about the future, okay? The more money you will earn, okay, your basic needs will remain the same. The more money that you earn, okay, that will just go into buying more luxury. It can be buying expensive clothes, okay, it can be buying expensive cars, it can be buying expensive homes, okay. But what I feel that, with more money you can just have more luxurious life. I don't think that you can have anything more than that with money, right? So what I feel that money should not be criteria. Money should never be a criteria, okay. And I also want to tell you that earning money, let's just assume that these things does not matter. You want to have a luxurious life, good. You want to have luxury cars, you want to have big homes, okay, no problem in that. मान लिया तुम ये सब चाहते हो, ठीक है. बट मैं एक चीज़ बताना चाहूँगा कि दैट मनी डज नॉट डिपेंड अपॉन द ब्रांच, ठीक है. तुम कितना पैसा कमाओगे वो ब्रांच के ऊपर नहीं डिपेंड करेगा, ठीक है. फॉर एग्जाम्पल लेट्स टेक अप एजुकेशन इंडस्ट्री, ओके. सो इफ यू टॉक अबाउट GRG sir, okay, with pharmacology he has earned so much money. I don't think even big surgeons in Delhi will be earning like the way he has earned, right? So this is just one example, okay. Money will not depend upon your branch, it will depend upon your skill, ठीक है. For example, if I just take up 2 radiologists, okay, so one radiologist was an average radiologist and the other was a very good radiologist. So this good radiologist is working in AIMS as a consultant. His salary is 1 lakh rupees. I don't demean this person, right? And this average person opens up a center and that center starts working. He starts earning 30 lakh rupees per month, okay. I don't say that the person who is earning 30 lakh rupees per month with his own center is is having a better status, okay. And this person who was intelligent, who has become a consultant in AIMS, that is not a higher status person, or he is a failure, okay. What I just want to tell you that money is not going to depend on the branch that you take, okay. Earning money is a different skill. If you want to earn money, start your own business, okay. If I talk about Prep Ladder, right, the CEO of Prep Ladder, okay, Dr. Dipanshu sir, okay. If you talk about any CEO of any company, any bigger company, okay, they if I talk about doctors, okay, so they even like if I talk about Dr. Dipanshu sir, he did not even do MD, right? But he still must be richer than most of the people, right? So what is the funda? Okay, so the funda is that money will not depend upon the branch. Okay, money depends on your own skill, on how much money you are going to make. So never go for any branch just for the money, right? So instead of getting confused by people, when you will take up medicine, okay, people will say to you that go for radiology में वर्क लाइफ बैलेंस है, रेडियोलॉजी में पैसा है, ठीक है. when you will go for radiology, people will say go for medicine, रेडियोलॉजी में कुछ नहीं रखा, आर्टिफिशियल इंटेलिजेंस आएगी, with time the requirement of radiologists will decrease. Okay, so guys, what I feel that अगर आपका अच्छा रैंक आया, if you have got a good rank, so I feel that this is the opportunity. What? Okay, so for example, if you have dreamt of becoming a surgeon, so this is the opportunity. The thing that you were studying for, this is the opportunity to go for. Okay, you had decided of doing surgery. Okay, now this is the opportunity to actually follow that dream. If you had dreamt of doing going for any medical branch, this is the opportunity. If you like kids, you want to do pediatrics, okay, now this is the opportunity. After getting a good rank, okay, this is the opportunity to go for that thing, right? If you wanted to do radiology, you wanted to have some free time for yourself and you want to pursue other things also, this is the opportunity. Now you don't have to get swayed by other things, other good things in other branches, right? If you had liked a branch such as gynecology, in which there is mix of medicine as well as uh, surgery, right? Now you had liked that branch, now this is an opportunity to actually follow that thing. Now don't get swayed कि यार गायनेकोलॉजी में बहुत जागना पड़ता है रात को, they have a tougher life ahead. Okay, I just want to tell you that life is never going to be easy. Life is never going to be easy. Okay, whether you take up any branch, okay, even if you take up radiology, life is not going to be so simple, right? So, and there will be cons with every branch, there will be cons, there will be problems with every branch, but an optimistic person, a positive personality should only look at good things, and better things, right? That should be the main focus. So if you like something about medicine, if you like something about radiology, if you like something about gynecology, okay, you just need to have that picture in your mind. If you have some role model, for example Naresh Trehan sir you have as your role model, then you have to have that good thing that I want to become like that person. Okay, I want to become the best neurosurgeon in the world. Then you just need to have that picture. Okay, if you have to become Sachin Tendulkar, if you have to become Novak Djokovic, okay, then obviously guys your life cannot be easy. You will have to put in extra hours in your duties. You will have to study more in the future as well. You will have to clear MCH MD exams. Don't think that life is going to be easy if you want to pursue your dreams also. Okay, and I want to tell you one more thing. Okay, when you do something that you like, okay, for example, if I just compare this thing with another thing, for example, you don't like studying, right? And you like to play games, video games. So guys, if I ask you to play 12-hour video game, okay, you will not have a problem. You will not have a problem in playing 12-hour video game. But if I just ask you to study for 10 minutes, you will cry. Okay, you will cry. So the point is if you do something with passion, Okay, it will not matter even if you are doing that thing for 16 hours. But if you don't do anything, if you don't do anything with passion, then even 10 minutes will become a curse for you. Then even doing 10 minutes of that thing will become a curse for you, right? So if you have a passion for something, I feel this is the biggest opportunity to go for that thing. You have to close your eyes and ears to all the naysayers who are stopping you, right? you know anyone, when I was taking up radiology, okay, I felt, just I let me tell you that at your time, we are not mature enough to make right decisions, okay, but we have to, but we are but we should still listen to our hearts, okay. At the time I was taking up radiology, there were many people who told me radiology branch अच्छी नहीं है, रेडियोलॉजी ये नहीं है. अगर मैं मेडिसिन भी लेता ना तो भी उन लोगों ने वही कहना था. और the main thing is that the people that you are talking to, most of the people are jealous of your ranks, most of the people are jealous of the opportunities that you are getting, okay, and they don't want to show you the right future also, right? They don't want to show you the right things also. And maybe the people that we are taking opinion from, they are not even successful in their jobs also, and that is why they are giving wrong opinion about the branches also. So you just have to take opinions, okay. You, even my opinion, you just have to listen to it, okay, and just make an opinion afterwards. So just remember that this is the biggest opportunity to go for the dream, for your dream, right? So when you will just now this is the biggest opportunity, and if you are clear that this is the biggest opportunity to go for this branch, then your doubt about one branch versus other will go away, right? And what other thing that you can do at this moment, okay, you can just imagine yourself, you are exposed to a little bit of things in every branch, right? You can just imagine yourself doing those things, okay, and then you have to just imagine how you will feel doing, seeing the patients, or picking up radiological findings, making up diagnosis, okay. You, at this moment of time, you can just imagine to do those things, okay, and this is going to help you out, okay. So if I just give my example, okay, I had some interest in surgery, okay, and I thought I had some experience in an internship with the surgical posting. Then I just imagined myself doing the dressings of the patients in the first year, okay, or being available there for 72 hours, or almost the entire week, okay. Then I just imagined myself preparing 1 year, another 1 year for MCH, and I tried, and these things created a little bit aversion in my mind. These things started scaring me, and then I decided that maybe even if I devote 10 years in surgery, I may not become one of the best surgeons. And within my mind, I had some other priorities also. I loved teaching. I had passion for teaching. I wanted to. I have a passion for physical activities. I have a passion for music. I felt in my mind that this is an opportunity to follow my other passions also. Okay. If I don't take up this step, I may not get these chances from other branches, right? So you just have to imagine, and you have to feel about how you are feeling, right? How you are feeling, and you have to write down all those good points and bad points. And then there will be bad points in every branch, even in radiology. This question is a very irritating question that I will not have to interact with the patients. I will not be giving any drugs. I will not be prescribing any medicines. So this question also started, starts scaring you. You will not have any clinical exposure. So these things also starts coming to your mind. Okay, then ultimately you have to look at your priorities, and that will help to go for one branch or the other. And I will tell you that the if you have passion for something, that is the best thing to go for. Okay, that is the best thing. No matter how much you are earning in any branch, how much, you know whatever you are losing, okay, whatever you are losing in some other branch, don't worry about that thing. Okay, just go for your passion. That is my message. So same topic. So if I just have to simplify, okay, which people can go for medicine. Okay, so for medicine, okay, if you have already made your decision during the mbbs, okay, during the mbbs, that you have to go for a medical branch. Okay, you had made your decision during the mbbs, you were a good student during the mbbs, you have gold medals, right? You have good clinical knowledge. Okay, then I would advise you go for medicine. You are not going to like radiology. You are not going to like radiology if you are a good student, if you are a clinical guy. Okay, then any day you should take up medicine. For radiology, okay, for radiology I would say that if you were an average student during the mbbs, then during the internship or during the post internship period you studied a lot, and then you got good ranks. Okay, so for that person, I can say that you can go for a radiology, right? If you have other passions also, okay, it can be teaching. It for me it was teaching. I had taken up teaching as one of my passions. Many other radiologists also took up this passion, like you all know the names: Dr. Zainab Vora ma'am, Dr. Nikita Nanmani ma'am. Okay, they started, they gave up their radiology and they started doing radio teaching as their full time thing, right? Though they were good in radiology also. Okay, so if you have some other passions, then radiology is a very good branch. Okay, if you have any passion for music or any other passion, okay, you want to follow that thing also, then for those people radiology is a very good thing. And if you don't have any passion, you just want to work for 9 to 3, and you don't have any aim what you will do after 4, then for you radiology will again be a trouble. Okay, then you will get bored with your life, what you have to do after 4. So I feel that you need to have some kind of passion if you are taking up radiology as your branch, right? So one was a good student, good clinical knowledge, good during the MBBS, go for medicine any day, right? Don't take up radiology. Okay, you will not like it. Okay, if you are an average student during the MBBS, you don't have so much passion about medicine. Okay, for you every branch is good. You have passion for other things also, go for radiology. Money should not be a criteria. Okay, I will tell you about money that 10 years down the line, okay, a gastroenterologist can have a job. If I just talk about the job, okay, a gastroenterologist can earn 10 to 15 lakhs per month, but a radiologist will only earn 3 to 4 lakhs per month. 10 years, okay, down the line. Early on, okay, definitely a radiologist will earn more as compared to medicine. Okay, but if both of these people have their own practices, okay, if they have their own practices, at that time I can say that even radiologists can earn 52. When you have your own practice, then the upper limit, there is no upper limit. Okay, even the radiologist can earn up to 15 lakhs per month, 1 crore rupees per month. Okay, if you have your own practice. And even if you go for teaching as your passion, many people are earning in crores also. So this was about medicine versus radiology. Why did I take up radiology? So I have already told you that one reason was I made up my own decision. Okay, I cannot say that the perspective that I had about radiology 5 years back will be the same perspective that I have from 5 years from then, right? My perspectives about radiology has changed. But what I thought at that time was that, I will have time, okay, and I will utilize that time to do something else, to do something bigger, okay, bigger than becoming a good doctor. I cannot say I was actually able to do that, okay, but I had these aims that I wanted to do teaching, I wanted to do a YouTube channel, I wanted to learn music, I wanted to write books, okay. So I had these kind of aims, and I thought that taking up radiology will help me fulfill those aims. And I also had that scare that if I take up surgery, or surgery was the thing that I had thought of before taking up radiology is something that I never, and that no one ever thinks of, okay, while they are preparing for their NEET PG exam. So surgery was one thing that I was interested in, right? But I thought that let's go for radiology. Okay, very difficult to explain in words that why did I take up radiology as compared to surgery, but these were few points, right? Okay, now guys, I wanted to give you some idea about radiology in LNJP and GB Pant. Okay, so many people are asking me about this, okay, whether they should give GB Pant over LHMC, whether they should keep GB Pant over LHMC. Okay, so I will tell you that GB Pant is a very good hospital, okay, is a very good hospital. You have spectrum from cardiovascular imaging, okay, you have spectrum from gastrointestinal imaging, neuro imaging, right? So these are the three basic spectrums that you are going to see in GB Pant. That is the only side disadvantage. But the greatest advantage is that you have a good number of MRI postings, okay. I will tell you that an average resident will have an 8 to 9 MRI postings in GB Pant hospital. In LNJP, you are just going to have 3 to 4 MRI postings in 3 years. In 3 years, right? Here the number of CT postings can exceed to 12 to 12 to 15, but here the number of CT postings will be only between 4 to 5, 4 to 5, okay. The number of CT postings will be 4 to 5. So this is one of the right. And ultrasound, ANC will be absent. You will not see ANC here, okay. ANC will be there, but the problem is you won't be allowed to do freely, okay. ANC you will not be allowed to do freely in the ultrasound rooms, okay. So mostly the SRs are doing the ANC scans, so this is again a problem. So what I feel about GB Pant hospital is that you will learn only few things, but you will know these things better than anyone else. In LNJP, in VMMC, you will have a spectrum, you will see spectrum from about every system, okay, but you will not be able to internalize everything, right? So GB Pant is a very good option, okay. For general spectrum, you can go to other hospitals during the senior residency also, right? So even if you go for the work environment is very good, the consultants are very friendly, that is the biggest advantage. And yes, and even the intervention radiology will also start soon in GB Pant hospital, right? Now guys, options after MD, okay. So this is something I wanted to talk upon. or options after MD or SRship, right? So the way you are confused now, okay, what to do, even you will be confused after 6 years of age also. Okay, after 6 years also you will come at the same stage, the stage at which you are now. Okay, so what is this stage? Okay, basically it is the stage at which I am right now. Okay, options after doing MD and SRship, right? So guys, if I broadly divide the options, so there are four options. Okay, so let's go from, okay, from in order of increasing money that you are going to earn, right? Increasing money that you are going to earn. So guys, the first option is being a consultant in a medical college, government or private, right? So guys, many people go for this. The reason for going for this is that people are passionate about their branch, and people have a job security and a fixed income, right? This is the biggest advantage that you have of becoming a consultant in medical college and government college. And those people who say that, who don't have work life balance, so if you actually need work life balance, you can go for this job. You can become a consultant in medical or government, in medical college, in government or private sector, right? Here your hours will be fixed, whether you are a neurosurgeon, whether you are a radiologist, your hours will be fixed. So this is a good option, right? This is one option that everyone has, right? Right now I will not talk about how much vacancies are there, okay, in these areas, right? Then the second option that you have, okay, of joining a corporate hospital, okay, okay, any corporate hospital like Fortis, Apollo, Max, okay, these are the second option. Again, you are going to have a good package, okay, a package more than that you are getting in government medical college or a private medical college. But the problem will be that you will have to do a little bit more work. Okay, this is the problem of joining a corporate. And the good thing is that you will have a better salary. Okay, then the third thing that you can do is joining a small hospital. Okay, if I'm talking about radiology, it can be joining a small diagnostic center, right? Joining a small diagnostic center, right? So what is the advantage? Okay, the advantage is that better packages as compared to corporates, right? The disadvantage is that you know the kind of work, okay, that you are going to do, that will not be good. So if I talk about radiology, okay, so if you get a package of approximately 6 to 7 lakh per month in a diagnostic center, mostly that diagnostic center will have ultrasound and x-ray as the modality. You will not be doing CT and MR, right? And same way for other branches also. If I talk about orthopedics, okay, if you are working in a small hospital, so what will happen, you will just be treating fractures only. Okay, you will just be doing nailing and plating. Okay, and that will become a repetitive thing, that will become boring. Okay, but it will have a better package. And the fourth option is you open your own center. Okay, you open your own hospital. So that has another group of challenges which I cannot explain you very well. You have to discuss it with someone who has already opened his own hospital or opened his own center. But the main problems are that you need to have a capital. Okay, you have to invest a lot of money. Okay, then you need to have the managing skills also. You have to you have to be available 24 cross 7. Okay, so when you set up your own radiology center, in the initial days, you may not get any profit also. You may not, you will be investing from your own side, but still you have to be there for 12 hours even if you are at loss. Okay, so that is the biggest inertia of opening up your own hospital. Okay, and you also have that worry, will that hospital or will that diagnostic center earn you profit in the future? So that is another thing of worry which should be kept in mind, right? And fifth thing is that people go for further fellowships in various things. Okay, and when they have done their fellowships from other colleges or from or any international fellowships, then they will again come into this cycle. Okay, they will have these four options. Okay, so these are very difficult options. You have to see again what are your priorities. You want more worries, you want more money, you want more of you want. And I will tell you that the best work is done by the people in this category. Okay, by the consultants in government and private medical colleges, what I feel. Okay, or even corporates also. Here, doing good work, good quality work, there are less chances, right? Now let us discuss another point: how to decide college brand names, state colleges, bonds, north versus south. Okay, so few opinions that I have. Okay, few opinions that I have. So guys, you should never go for brand names. Okay, like MMC, VMMC. I never advise anyone going for the brand names. Brand names do not help you. Brand names will only help you enter into a place. Okay, they will only help you enter into a place. They will not help you to survive in a place. If you have to survive in the future, it will only be your it will only be your capabilities, it will only be your knowledge that will help you survive in any place. It will not be your brand name, right? So never go for brand name. If you have a good college that is very similar to these colleges in your own state, okay, in your own city, then I would ask you that you always wanted family life, work life balance, then go for that college. Don't go for MMC, BMC, or even Delhi colleges, right? And if you are from south, you have good colleges like Madras Medical College or any good college in Bangalore. Okay, if you are from south, go for that. Any good college in Kerala, Tamil Nadu. You don't need to come to Delhi just for the stipend, just for the brand name. Okay, stay in your own state. Start building your connections. Start building your connections from the first day itself, in your own state, in your own city, right? And some people do not choose good colleges because they have bonds. So guys, I will tell you that bonds, after doing 3 years of post graduation, you have to do an SR-ship, right? And if your college is good, it does not matter if you are doing if you are completing a 1 year or 2 year bond in that particular college. So I feel that you should not be scared if bond is there in your college, in your hospital, right? So anyway, you have to do senior residency afterwards, after doing your post graduation, so it won't matter much, right? So guys, two more important questions: that will you make the right decision? Okay, so guys, I think that at this age, just clearing the MBBS, okay, I think we are very less exposed to various branches. Okay, we do not have the actual experience of how we are going to feel when we will be there in a particular branch. Okay, even if I talk about radiology, okay, every day I am learning, I'm having different experiences about radiology. Okay, so if I say that before taking up radiology I had every idea, okay, how will radiology treat me, or how what will happen to me with radiology, I cannot say that. Okay, if you are taking up medicine, if you are taking up surgery, you think that you will have all the idea of how that branch will treat you, or how what kind of experience that you are going to have. Okay, that is not going to happen. So whatever decision that you are going to make will be, from the little experiences that you have during the internship, will be the little experiences from the people who have shared their experiences with you. Okay, and this will be based on the limited viewpoint that you have. Okay, and I can say that, most of the students, they will make an uninformed decision. Okay, like the decision we made about, MBBS. Okay, so when we made a decision to take up MBBS, did we even think about MD, MS? Okay, even if we thought of becoming orthopedician at that time, did you know did that passion still remain with us after doing 5.5 years of MBBS? I don't think so. Okay, I don't think so. What we had thought on the first day of MBBS, we still think the same after doing 5 years of MBBS. Okay, our passions change, our mindset change. What we want to do in the future, that also changes, right? And what view have we what view we have about MBBS, that also changes, right? So we cannot say that thing also. So now, okay, I will not give you the answer in yes or no, will you make the right decision. Okay, now the question is, will it matter if you make the wrong decision? So guys, I just want to tell you that, once you take up any branch, there will be many good things, there will be many bad things. Okay, so it does not matter what bad things you are facing. It depends what kind of a personality you are. Okay, if you are that kind of personality. Okay, if you are someone who has done well during the MBBS, during the NEET PG exam. Okay, whatever branch you will take, you are going to do good in that branch. That is what I feel. Okay, it depends upon your personality. Whatever challenges you are going to face, you have to be optimistic. Okay, you have to be optimistic, and you have to happily accept those challenges, and you have to move forward. Okay, and what really matters, once you take up the decision of going to any branch, okay, you need not have any second thoughts about other college or any other branch. You just need to think that how good you can do, what good you can do with that branch. Okay, and how good you can become in that branch. This should be the focus, and that is what really matters, right? Branch is nothing. Okay, so if there is a person who has done medicine, okay, but he is not a good clinician, then taking up medicine is of no use. Okay, if there is, if you have taken up radiology and you have not studied your radiology well, you are not a good radiologist, you are missing simple diagnosis, then there is no point of becoming a topper during the MD, right? So this is just not one step. Clearing NEET PG exam is not the only step. You have to take multiple steps throughout your life to become successful, right? So it mostly, it depends how much justice you are doing to your job, and how good you are doing your job, right? So at last, guys, I will say that you should go with your heart, close your eyes, and go with your passion. And guys, all the best for your biggest opportunity, for the biggest decision that you are making for your life. And do let me know in the comment section that if this session really helped you or not. Thank you.